Janine Aitken, and I'm the Digital Networks Officer for the Health and Social Care Alliance, and I lead on the Digital Citizens Panel. So the Digital Citizens Panel has been developed in partnership between the Health and Social Care Alliance Scotland and the Scottish Government's Digital Citizen Delivery Board. So it's really been developed in response to the board's aim in engaging and empowering the Scottish people to share their voice and their experience in developing digital health and care. The aim of the panel is to hear the voices of people and organisations across Scotland on their needs, rights and preferences on using digital means to better manage their housing, health and social care, to design and deliver an inclusive and diverse programme of engagement and communication, and to capture insights, learning and feedback, thus contributing to the board's aim of empowering citizens. How is this achieved? So this is achieved through the provision of a variety of engagement opportunities, such as surveys, focus groups, online events and workshops, or by phone, email, and hopefully very soon in person. So really at the panel, what we're trying to do is we engage people in any method that is supportive and appropriate to the person. So for instance, the other day I contacted a lovely woman to speak to her about the digital front door and to get her a little bit of feedback from her on her ideas and her experiences, simply because she doesn't like to use digital. So we aim to try to support people in any way that fits the person. Some examples of the kind of more recognised work that we've been involved in is the Respect Recommended Summary Plan for Emergency Care and Treatment. This is about end-of-life care. GP DACS, which is the online consultation system. The data strategy, and more recently, as I said, the digital front door. So we have just developed a survey and sent that out to the panel members, and we're planning soon to do an online event that will take a bit of a deeper dive in terms of developing the digital front door. More recently, I have organised informal learning sessions. These take place once a month, and this is just really an informal platform to come together and to share ideas and asks, things that the panel members are interested in finding out about, or about sharing information, rather than it being about the Alliance or the Scottish Government. So we're really just trying to give back to them. Since its launch in 2021, the panel have delivered 10 events in partnership with stakeholders from across health, social care and housing, and with a total attendance of 250. So there are 95 panel members, and this is broken down into people with lived experience of long-term conditions, representatives of services, including stakeholders from integration authorities across Scotland, and those people with caring responsibilities. However, this isn't a simple breakdown, because the mapping activities that I have carried out has shown that whilst representatives of services identify first as a representative of a service, they are actually, the vast majority of them have lived experience of long-term conditions and or some caring responsibilities. The specific areas of focus of the panel, we are really trying to make the panel as inclusive as possible. We're trying to minimise digital exclusion, and we'll use whatever methods that we can to engage people and to ensure that the panel is as inclusive as it should be. We're trying to make it accessible, and again, really just taking into consideration people with sensory impairments and trying to minimise the barriers there. We're really focused on marginalised groups and ensuring people have a voice, seldom heard and absent voices. So there's a real focus and a drive in ensuring that their voices are present. We are focused on the human rights principles in digital health and social care, and Chris will speak a wee bit more about this when he comes on. So I'm not going to cover too much on that, but we do try to adhere to these. Future plans for the panel. So we have just been given additional funding until 2024. And the plan is to really just recruit, to build on the numbers that we already have, to ensure that the panel is as representative as possible, and to develop the panel to really individualise it and to tailor topics and programmes to specific needs. And thank you very much for listening. Here's my contact details if anyone wants to contact me to ask any questions, or if you want to share information or to network. I'm quite happy for you to contact. Thank you.
Oh, that was lovely, Janine. Thank you so much. That was really good. You're also active on Twitter as well?
Yes, I'm on Twitter. I've actually forgot to put my wee Twitter handle on that.
Yeah,
I will do that.
Put it in the chat if you like, and then people can follow you. That would be great. Chris has joined us as well, so we'll get them on once we've had a few question and answers. I was fascinated by the work that you've been doing, Janine, and I know it's just such an interesting project to get involved in. When we heard it was 95 people on your panel, I thought that was tremendous. So are you planning on growing the panel, or is this how it sits now?
No, we have an ongoing recruitment drive, and that's to try to make the panel as representative as possible. So we're trying to include as many people as we can, and just ensure it is representative and inclusive. Yeah,
and you've got that geographical spread as well.
There's people. People from throughout Scotland have joined the panel. So again, we're just really interested in increasing the numbers.
Yeah. What sort of activities do you do with the Citizens Panel?
At the moment, the majority of the activities has been online events. However, as we move forward, we've also engaged actually with a survey, and just any engagement that's relevant or appropriate and meets the needs of the panel members as well.
Yeah. So what sort of events would you hold for them? What's it you're trying to find out from them or to give them?
The aim of the panel is to really get the voices of lived experience of long-term conditions and people who are unpaid carers, anyone with caring responsibilities, to help shape and develop and improve digital health and care.
Yeah, and that's very familiar to us and aligns well with our Making IT Good for Society as our strapline for BCS Health and Care Scotland and BCS overall. Sharon, would you like to ask a question? Please join us.
Good morning. Excellent presentation. Thank you. Janine, do you mind telling me?
You're a bit quiet, Sharon. Can't quite hear you. Aha.
Can you hear me now?
Yes, most definitely.
Excellent presentation. Thank you very much. Janine, I wonder if you can help me just to understand how you would address somebody like me whose English not his first language. I find it quite difficult to read and write in English. How do you reach out to people from that segment of society?
We are trying to reach people who are in asylum seeking communities and people whose first language isn't English. We also have access to interpreters where necessary to support us in that, and we'll just really use any method that is possible to engage as many people as we can.
Thank you.
Thank you.
And what's your main method of getting more people involved then, Janine?
Really just a bit of a recruitment drive, so just promoting the panel and speaking to as many organisations and as many individuals as we can.
Yeah. And did you ask people to bring along friends to join in, or that sort of snowballing recruitment? Yeah,
we have. We've spoken to the panel members themselves and just reminded them, please get as many people involved as you can.
Yeah.
Can I ask another question? Sorry, Katie, just something. Is the panel available to other organizations? If we want to ask you questions on behalf of, say, we're looking at education and digital education for citizens, Are you the mechanism to engage with stakeholders or with your panels and get the views back to us? How do we do that?
That's actually a great question. Chris, I think you might be able to answer this better. Chris is like, you're just putting me in the spot.
Sharon has a habit of asking really good questions.
Really great question.
Yeah, he's also from BCS Health and Care Scotland.
Ah.
Yeah, okay. So I've just come from the Health, Social Care and Sport Committee, so I'm used to being on the spot. I think this is a really good question because at the Alliance we seek to put people at the centre, and the Digital Citizen Panel is a way of doing that. However, it is funded by the Scottish Government, Digital Health and Care Directorate. So much of the work of the panel will be work that's come from the Digital Health and Care Directorate, and the panel does feed into the Digital Citizen Delivery Board. So we have a route into quite a high level at Scottish Government, and that's a good thing. However, there's a tension there between sort of putting people at the centre and having them set their own agenda against whatever the government says, well, the panel should be looking at, and also, as you say, there's other things going on in the digital world other than the things that are coming from government. In fact, there's a lot of things going on in the landscape at the moment. So one of the things that, this is going to be a bit of a non-answer, I'm afraid, but the funding dictates to an extent the work of the panel. But we have our own principles, and we're in the process. We've just agreed future funding for the panel. So we're going right through to March 2024 with the just very hot off the press funding commitment from the government. So that's a good thing. But we're also needing to tease out some of the governance of the panel, and what do we do with all the different things that are out there. So as I say, it's a bit of a non-answer that we're very much aware of the issue, but it's something that we need to get to the bottom of, in terms of just saying, well, what if the panel identify something that they want to go off and do and spend time on? How do we manage that situation? So Janine and myself will have the joy of getting to the bottom of that, and probably working with our contacts at Scottish Government around that. But you know, I think it's fair to say that they'll want the biggest slice of the pie when it comes to the time of the panel. But you know, we're dealing with people who are volunteering their time to be involved in this, so we need to be mindful of that as well. You know, and you know, I think the numbers are great. That the work that Janine's been doing has been great in terms of generating that interest and that momentum behind the panel, and it's really good to be having this conversation with you today, because I think this is the sort of thing that, you know, there should be much more of, and you know, it's not the only piece of this kind of work, but certainly this is, you know, this is I suppose maybe the most prominent piece at the moment.
Oh, that's amazing, Chris. Thank you. Jeannie, anything else you'd like to add just now, or will we go on to Chris's presentation? What do you think?
I think we've covered everything. Thank you very much. Thanks for inviting us. It's been a real honour.
Doesn't want to unmute? That's wonderful. Really enjoyed it, and I'm sure we'll have other questions at the end. And Chris may well want to bat one over to you just to return the favour. So Chris, would you like to start your presentation, please?
As if I would. Okay, so yeah, I'm going to try and share screen. How does it? Right, how is that? Can you see?
Brilliant, Chris, we've got you. Excellent. Okay. Over to you.
I'm the Digital Hub and Alice Programme Manager. So what that means at the Alliance is that we've recently formed a digital hub, which includes lots of digital health and care engagement work, which includes the Digital Citizen Panel. And I'm going to cover some of the other things that are included. I joined the Alliance just over a year ago as the Alice Programme Manager. So that's quite prominent in my thinking and in the work that I do. Okay, so firstly, I'm going to cover Alice, I'm going to cover Discover Digital, and then I'm going to talk about human rights principles in digital health and care. And you can ask questions on that or anything at the end. Just for covering Alice, first of all, Alice is a co-produced web-based system for finding and sharing information about community assets across Scotland. So it is a system, it's a tech system, and to some extent that's where my energies are focused, is around the technical aspects and developing this system, a local information system for Scotland. It's been around for about 12 years, and the way in which it works is that it's co-produced in the sense that we work with people who are either using the system or likely to use the system and talk to them about what they would like to see with it. We also encourage people to share their information, and I suppose one of the key sort of philosophies of Alice is that kind of bottom-up approach. So we're not only co-producing the system in terms of how it works technically, but we're also almost crowdsourcing information from communities and getting people to share their own information about services that they operate or are involved in, or to become editors within Alice, which is whereby people who are either workers, volunteers, or citizens in communities, they share maybe information about a range of things that are going on locally for them. And as it says there, the primary aim is to make information about those community assets easier to find. And so what we're keen to do is to grow that information resource. So we have at present about 5,500 services on Alice, and so we're keen to grow that number, which is one of the planks of our strategy. So having more data, so encouraging people to put their information on there or to claim information that's already there. So maybe you operate a service and you find it on Alice. The aim there is to get you to claim that information, and then ideally you would keep it up to date. And the second plank of our strategy is around better data, so better quality of information, more up-to-date information, which is a job that's never really going to end, because it's like the fourth bridge, that once you finish painting at one end, you've got to start at the other end. And I think that's where Alice sits, and the work of most kind of directories of this nature. That as soon as you publish something, it goes out of date, or somebody moves house or changes their email address or something like that. So the data quality is important, and it's something that something that the committee have just asked me about, actually, but it is something that's very much on our agenda in terms of the information that's there. So so we are a team. Aside from myself, there are 4 members of staff within the Alice team at the Alliance. We have a user researcher, and Catherine, our user researcher, works on the quality of the experience, I suppose, of users of Alice, and specifically she's been looking at accessibility, and so what we're keen, in line with the principles of the Alliance, we are keen that Alice is as accessible as it can be. So it's available and makes sense on as many different devices as possible, but it's also it is also able to be used by as wide a range of people as possible. the user research that we're doing just now specifically is around sensory loss, and that is in tandem with our sensory hub at the Alliance. And so we've been doing some focus groups around that, and this is looking at we actually have a beta version of the site, which the focus groups have been looking at and just testing out for us. So I mentioned technical aspects, and myself and Lorna, who's the coordinator, work on the sort of technical side of things. And you know, obviously there's with a system like this, there's always bugs that come up, little glitches that come through. So it's important that we have solid technical foundations, but there's also some principles there which are on the slide. So the open data principle, which means that we have an API, an application program interface, which means that people can access the data publicly without going through alice.org, that they can maybe surface Alice data on their own websites. And we see that with NHS Inform, who use our data set on the Scotland Service Directory part of NHS Inform website. And a recent example is the Glasgow Alliance to End Homelessness, who've got a section in their website called Get Help Glasgow. So homeless people can access information and support in the Glasgow area, but they're actually accessing Alice information. So having a public open data policy is key. Just on the open principles, we're also open source. We're also using open referral standards. Co-production I've mentioned, and agile approaches. We're keen to I suppose come back to the thought that the Alice will never be finished, that there's always going to be iterations and advancements that we want to make. So we're using agile methodologies, and more so our developers actually are using agile approaches. Finally, and probably where most of our work, we have 2 engagement staff members within the team, Cameron and Angela, and because Alice is as much about the people as it is about the technology, and in fact it's more about people. So we do things like community roadshows, training sessions, and we do, you know, networking and just general engagement and partnership work with local organisations, umbrella organisations across the country, and different people who can either benefit from finding information on Alice or sharing information on Alice. I could talk all day about Alice, but I won't. I'll move on and just talk about Discover Digital. And Discover Digital is a programme of work that is seeking to help people to navigate what is becoming a very crowded marketplace, if you want to put it that way. Certainly a crowded landscape when it comes to digital health and care and wellbeing tools. So we are keen to raise awareness of these tools and to help people to access them. And we've done quite a lot of work around this. We have something called a Discover Digital Guide, and we are in line with it, just in terms of the panel work that I've just said has been extended to 2024. We've extended the work of Discover Digital to 2024 thanks to continued funding from Scottish Government. And one of the aspects that we're actually able to advance with this new funding is providing funding to third sector organisations, looking at the smaller and medium-sized end of the spectrum, and assisting them to advance projects and to develop their own digital health and care tools, which would be targeted at their specific audiences. So we're not only looking at what's out there already, but we're keen to foster innovation in the third sector, particularly at that small and medium-sized end of the spectrum. And so, yeah, that's just some information about the Discover Digital Guide. It's quite a lengthy piece, and it's divided up into those 7 sections. And as you can see, it's available on our website. And again, with Discover Digital, we are looking to make that into an online course, and that's work that we've started already. But we're also looking to roll it out with roadshows, and hopefully we can do more in-person promotion of the Discover Digital Guide and the various sort of aspects that are included within there. Right, so yeah, funded projects. We have funded some projects regarding the engagement of seldom heard communities, and as I said, we are seeking to fund more of this type of work, moving on from the sort of engagement with seldom heard communities, but actually into looking to innovate and develop digital health and care tools for those communities. And finally, yeah, we have done some work with we've done some work with Scottish Care and Vox Scotland, Voices of Experience, and this has been work around human rights principles in digital health and care, and particularly relevant to a kind of what is a fast-paced environment in terms of change, and also you know, throughout the pandemic, we've seen increased use of digital tools. You know, one example would be the Near Me platform for online consultations, and I suppose what we're seeing is, yeah, these innovations are great, but they're not always respectful of everyone's needs. They're not always respectful of human rights that people have. You know, I think during the worst of the pandemic, there were innovations, there were changes made, which were maybe done quickly with the best of intentions, but we have seen groups being left behind. So people who don't have the devices, people who don't have the data connections, people who don't have the skills and confidence, they're being left behind. And so what we're seeking to do with these human rights principles is to say, oh, actually, we can do innovation, we can roll out digital services, but let's not leave people behind. Let's be respectful of people's human rights. So we've done some engagement last year, and we come up with these 5 principles based on that engagement. People at the centre is just what it says on the tin. It's not putting the tech at the centre, or it's not putting the services at the centre. It's putting the needs of people at the centre, and using that as a starting point. Digital where it's best suited. So there are things that are done well via digital means, and we see remote monitoring, for example, as being something which can be done much. The monitoring of people's, for example, blood pressure or diabetes or things like that, you know, can be done well through remote monitoring. But there are other things that are just better done in person, and that people would rather use, I suppose, quote unquote analog means, so non-digital means to engage with health and social care, and so it's important that we keep those avenues open. And moving on from that is the notion of digital as a choice, and that should be an ongoing choice. So people should be able to choose not to use digital health and care tools. They shouldn't be forced into it, because it's not for everyone. It can promote benefits. It can give people ways and means which are not available through non-digital means, but they shouldn't be the only options. The 4th principle is about digital inclusion, and that's about not just the data and the devices, but it's about the skills and the confidence in using digital tools. And a big chunk of that is about the population generally, but I think I would also highlight workforce needs there as well, in terms of, you know, if I'm going to join a Near Me call with my GP, is my GP able and confident to operate it from the other end? And I think, you know, from my perspective, I would expect them to be able to do so, but that's not always the case. And what we hear is that there are there's inconsistencies where some professionals are really confident in using digital health and care tools and others aren't, and it can be a bit of a postcode lottery there, dependent upon how confident the professionals are. Final point is about, and it's a big one, is about access and control of digital data. And what we're seeing with that is that people should have access as a default to the data that's stored about them. Now, this is a hugely complex area because of that word interoperability. Everyone's got a different system and they don't all talk to each other. There's no one-stop shop for data stores, and perhaps that's, you know, the answer. But I think what we would say with this final principle is that people should have access to their information. They shouldn't have to ask for it, and they should also have control over that data. So they should be able to grant consent for people, professionals, family, whoever it is, to see different bits and pieces of that health and care data, which they have access to, and that then opens doors in terms of making things much more seamless, and people don't have to tell their stories over and over again, because I think that you know, to some extent people expect data to be shared between professionals, but in actual fact it doesn't happen. It certainly doesn't happen to the extent that it should. But I suppose that, you know, we need to put, you know, just the caveat, which is about those checks and balances in place to make sure that there's safety and security built into whatever the future for data in health and social care looks like in Scotland. But I think, you know, that's the principle where we're looking to the future in terms of innovations that we hope to see, because, as I say, I think there's lots of benefits to that, and the engagement that I've done with people indicates that they're up for it. But you know, that there are questions and caveats that need to be put in place. But you know, the digital world and the world of data can open so many doors, both in terms of the individual, in terms of research, in terms of public health in Scotland. So I think, yeah, we're at quite an exciting point, and the Alliance is seeking to work with Scottish Care and Vox and Scottish Government to embed these principles in digital health and social care. And it's important that we add the word social, but we're seeking to embed these principles in the future of digital health and social care in Scotland. And I believe that is my last slide. So thank you very much.
Thank you, Chris. That was excellent to hear, and it's so important having the principles there and how we consider people's involvement in the digital and about their own health and care and the social elements around it, as you say, in housing and so on. Sharon, I think you had your hand up. You've taken it down again.
I was clapping, but I wanted to ask a few questions, if I may, to Chris, which I found the presentation fascinating. Chris, you were saying that digital should be a choice for citizens, and the British Computer Society, we're a professional body supporting the needs of the profession. Do you think digital can be a choice for professionals offering health and social care services?
I think that's that's an interesting point. I mean, I think that, well, as a worker who joined the Alliance in January 2021, digital was not a choice. It was a reality. Janine and I have met once. We've met so many times on the screen, but we've only met in person once. I think that it's really, yeah, it's a reality. And, you know, I look at, you know, we're putting together a job description and person spec recently, and I was looking at the must be able to use word processing, spreadsheets and things, and I was thinking, well, that's so yeah, but it's like running water, isn't it? You know, and you know, because your data connection, your internet connection is it's as important these days. So I suppose to answer the question, professionals need to be well versed in digital, the use of digital tools. There's no question of that. Do they get to choose? Well, no. I think what they should be doing is offering choice, and not being afraid of either digital or non-digital options.
Okay, that's a brilliant answer, and I wholeheartedly support that. As professionals offering services, we should offer the choice, but as professionally, we have to have the skills and the knowledge to operate in a technology-enabled environment. So you also identified in your presentation the fact that sometimes the competencies of professionals delivering services remotely or otherwise are not up to scratch. And you were saying that Alice is a platform, open source, that could be used, and we had this discussion before, could be used to identify resources, but it is citizen facing. Is there scope to have Alice as the hub for both citizens and those who support citizens in relation to signposting to resources that look at competencies, digital competencies, and quality assure some of them? Is that some of the vision for Alice?
Yeah. I mean, I think that, yes, we did have this kind of conversation before, and I think that what I'm keen to do is to broaden the scope of Alice into appropriate sort of adjacent territory to where we're at just now, and this is one that I am keen to look at, because I think that you know, what would benefit somebody's health and well-being, it could be, you know, some kind of resource for their own personal development. It could be training. It could be, you know, and as things stand, we can take that kind of information, but we're not particularly geared up for it, I think, in Alice. And I think that you know, in terms of staff, I think our intelligence is that there's quite a high usage of Alice for people searching on behalf of others. So and it's a bit of a sort of, we look at our analytics, for example, and we look at the use of mobile devices, and we see, I don't know, for example, there might be about 50% usage of mobiles and tablets, and we need to be better at our sort of user experience on those devices, which is kind of staggering if you think about it. But that's very much in our mind when we're looking at our new beta site. And we see maybe about half again of usage on desktops now, or I suppose that would be desktops, laptops, you know. So the conclusion I can draw is that those are probably professionals, and so we've decent usage from there. I think we could always have better usage. Our numbers can always be higher, but also we want to increase the number of access points. So I spoke about NHS Inform using Alice data, Glasgow Alliance to End Homelessness. We're looking to social prescribing software platforms. We're looking to voice activation. I can't say too much about it, but we're quite advanced in terms of consideration of an Alexa app. So I suppose, to come back to your point about competencies, I would be seeking to always minimize the competency that's required, and to have Alice as intuitive as possible, so that it's not a tough ask. And we do get a lot of traffic from organic search. So there's people who don't know about Alice will find an Alice resource by putting in, you know, I don't know, homelessness support Glasgow into Google, and it'll turn up an Alice resource. That's maybe not the best example, but you get what I mean. That the people come to Alice through search engine optimization. But again, you know, that's always changing. You could always do better on that front as well.
Can I ask a follow-up question to Katie? I don't want
yes,
to dominate.
of course. That's okay.
So the competencies is not necessarily just about using the platform, but competencies in terms of supporting citizens. So is it conceivable that a professional will look at Alice for resources to enable them to offer better support using digital means, and therefore Alice becomes a signposting or a hub of resources that are quality assured, or there is a mechanism of saying, if it's an Alice, therefore it's serving the purpose of citizens. It's fit for purpose. And if I'm a care provider in a care home, and I'm looking at, for example, the SSC as the governing body, I'm not sure whether I'll find education resource there, but I may find it on Alice as a kind of an additional resource bolted onto the SSC in terms of governing the competencies of the professional caring for me as a citizen. Does that make sense? But we can take it offline.
Yeah. I think that quality assurance is a tough one when you have a crowdsourced information platform. And so what we have is a lot of those resources, I would say, are not quality assured. We have ways of flagging things up if somebody finds something not to be appropriate or whatever. The quality assurance side comes at present, and I'm not saying we couldn't develop this, but the quality assurance currently comes from people claiming. So if you're operating a service in a particular area, if you claim it, then what we can say about that, we can put a blue tick against it and say claimed, and that implies quality. It doesn't guarantee, but what it says is somebody somewhere has taken ownership of this, so therefore they've taken an interest, and therefore you would hope that they would keep it up to date, and that's down to our engagement and maybe some technical means to prompt people to keep on top of that. You know, that they can invest, I don't know, 10 minutes every 6 months just to double check that what's on there is correct, and that gives them a profile which, let's face it, you can't get anywhere else. You know, there's you can't get that national profile for your service. Yes, there are local directories, but certainly for quite a small investment in time, you get quite a big return compared to what you might consider and have to do if you were, you know, putting together a social media strategy, for example, or developing your own site and ensuring the search engine optimization was up to scratch. You know, these kind of other approaches. What we were saying is, well, Alice actually gives you, you know, the infrastructure to put your very hyper local information on there.
Alice gives you wins.
Can I ask, is there any sort of crossover between Alice and the Digital Citizens Panel? Do you ask the Citizens Panel to look at areas of Alice, for example, or to add to it? Is that something that you've done in the past?
No, to my knowledge, I don't think we've done that. I mean, I think that what we have in the panel is a resource that, that we could use, and because I think that we need to use every avenue that we can to better Alice and to promote it. And I suppose, you know, you've hit upon a point where if we've got, you know, say 100 people who are interested in digital health and care in Scotland, they can help us advocate for Alice, because one of the, you know, points that came up in the committee that I've just come from was, you know, how come I've not heard of Alice? You know, you're and I my response would be, well, you actually need to resource Alice a bit better. But you also need to take some responsibility. You know, that it's not just about giving the Alliance some money and saying, right, go off and do this piece of work. It's about saying, well, if you're funding a national resource like Alice, then you actually have a responsibility, and I mean the government have a responsibility to plug us in politically and to do some of that promotion and comms work for us. Not that we're sort of absolving ourselves of responsibility, but you know, it's a two-way street, that we're doing this for a reason, because the government still thinks it's a good idea. But there are huge gaps in terms of people's awareness, and so yeah, I've made a much wider point when you were asking quite a specific question about the panel, but I think that's something that Janine and I can pick up, because, you know, as I've kind of said, the demands on the panel are many and varied, and you know, it's only likely to go up. But certainly, if the panel is a resource within the Alliance, we should be using that to benefit Alice. Equally, we should be, you know, if there's ways and means that we can develop Alice to promote digital health and care in Scotland, then, you know, we should do that, and we should use, you know, we should be working with the panel to do that.
I must admit, the only time I've come across it is either I've been in touch with the Alliance around something else, or at the face-to-face meetings we've had, and there'll be an Alice stand at the likes of DigiFest each year. And we might be neighbours and have a stand for BCS Health and Care Scotland. But in ways, we both probably suffer from under-promotion, and getting ourselves out there and recognised, and what we can do for our membership and what membership means around ourselves. And likewise, you've got this Alice being current and out there and really visible, and how you use your digital citizens panel and what that means for other organisations. And have you asked your digital citizens panel what areas they want to be involved in?
Yes, that's been part of me being introduced to the panel, and also part of the informal learning sessions. So yeah, really just getting an idea in the topic areas and the things that are interesting to them, and being able to develop the panel over the coming years as much as we can.
What sort of things are they interested in, Janine?
Connectivity, particularly people in the Highlands, that's been a really big one. Digital exclusion, that's the one that comes up all the time by most of the panel members, is how do we make sure that people aren't excluded, and obviously increase inclusion. So that's one of the big ones as well. Accessibility, there's lots of people in the panel that are representing people who they just can't use digital, so it's about them being able to give other people a voice in some ways as well. Yeah.
It's interesting that as people who can't use digital, that they come on a digital citizens panel. Do you know what's behind that? What encouraged them to join?
The people who we have who don't use digital and who are involved really just want their voice to be heard, and they're just happy to be able to feed in by telephone or even by email, which technically is still digital, but it's not online, do you know what I mean? So they're still interested in their voice being included.
So are they coming from a place which says you should have alternatives to digital?
Yes.
Is that their main?
We just don't want the remote digital services for the GPs in the hospitals, and yet there's other people who have rare conditions who are saying that digital has been a lifeline. It saves them from the hours and hours of travel and sitting in waiting rooms, and you know, it's a really quick. So it's trying to cater to as many people as you can, whatever way you can, and just trying to find really novel ways of doing that.
And congratulations on managing to get people onto digital citizen panel who are taking that stance, because certainly, how do you get in touch with people who are not involved? That's always the problem, isn't it? You know, you want to find out why people are not completing or not taking part in something, and they're just a huge, difficult sector to reach out to and find out how we can do things differently to involve them too, isn't it? So it's fascinating.
That's why it's really important to also have representatives of organisations, because they can then share that information and they can feed the information back and forward. And they can give voice to people. Like we have a woman who supports people with facial disfigurements who don't want to use online because of that confidence in mental health. So that's really good to be able to work with that woman in particular and be able to feed back information in that way.
Yeah, and hopefully build their confidence as well. And maybe someday they will actually step across and engage with the digital side of things.
Particularly in person soon, hopefully we're able to do a lot better capacity building.
Yeah.
Sorry, Katie, I was just saying that the BCS was in the past had the opportunity to promote the European driving license for computers. And it will be interesting to see whether there is any impetus, any desire to have a digital driving license for people like the citizen panel, whether they'll be interested in having some kind of a certification of digitally enabled or working towards, or and that's where I was asking the question whether we can use the panel as a mechanism to understand the market, the needs, the requirement for digital education and competencies. But I think you're doing a great work.